Our next session highlights innovative approaches to mental health support. Our two speakers represent a national online support program and a local community network that's building connections for frontline workers and providing education. I'd like to welcome Thomas Egdorf and Allison Cano. If they're here, we could spotlight them, that would be excellent. I don't know if Allison has joined yet, so Thomas, you're on the spot first. Just going to do a quick bio and then we'll invite Thomas to be our first presenter. Thomas Egdorf has been working at Casey House since August of 2022 and has been in the field of HIV for over 25 years. He has worked in a variety of local, provincial, and national organizations. Over the years, Thomas has presented on a range of topics, including grief and loss, the biomedical aspects of HIV and hepatitis C, leadership, communication, organizational governance, nutrition and cooking skills, and many other topics. One of his greatest achievements is the development of the Positive Leadership Development Institute, or PLDI. And in 2010, Thomas was inducted into the Ontario AIDS Network Honor Roll and recognized for his leadership. He was diagnosed HIV positive in 1993. Welcome, Thomas. Thomas and I have a long-standing relationship. We worked together for many, many years, and I am so grateful that he could join us today.
And thank you, Melissa and Realize for inviting me to speak today. As I was listening to the three previous speakers, I thought, oh, you know what we really need between them and me starting, or my session starting, is a bit of a grounding, a bit of a, those were some pretty amazing but heavy stories. And I just want to take a moment and just ask people, as you're able, to put your feet flat on the floor, maybe give them a little tap. For some people, breathing is a really great way to come into space. I use a grounding stone that I have in my by my desk, and my thing's blurred, so you may not be able to see it. Just any stone I use, but you can use really any grounding object or none at all. And I want us to just take a moment and either do some deep breathing if that's comfortable for you, or notice your breath, or tap your feet on the floor, and just take a moment and appreciate that you're here, that you've taken the time out of your day to be at a mental health workshop. Most, if not all of us, deal with some form of mental health challenges. Sometimes that's episodic, sometimes it's ongoing. I know I've dealt with depression and high anxiety in many parts of my life, and doing some sort of a grounding can help with that. So I'm going to just say, let's take a moment. This will give the interpreters a moment to relax as well, and do a couple of deep breaths or whatever works for you, and just give yourself some appreciation for being here, for being present, and for being in this work. Thank you all for indulging me in that little exercise. I hope you took part in it. Normally I would do that for longer. I've done grounding for a minute up to 5 or 10 minutes. And if you want to learn more about grounding, my previous role was at the AIDS Bereavement and Resiliency Program of Ontario. And they have a course on grounding and different ways to ground. And I'm just putting their website in the like you have to do the www thing, but in the chat there for you. I'm gonna share my screen. Oh, I'm going to wait for the host to enable screen sharing for me. As Melissa mentioned, I work at Casey House. We've just celebrated 35 years of being in existence, which is a wonderful milestone. But also a sad one that we had to come into existence at all. And the reason we did in 1988 to become a hospice is, for those of you who are around then know that many people living with HIV weren't treated well. In addition to physical health issues, there was an enormous amount of stigma, and people in hospitals would often have their meals put in the hallway because people were, the staff were afraid to come in and serve them, or to clean their room or change their bed linens. And that was, it was a really hard time. So places like Casey House came to be into existence to provide a stigma-free environment, a place that treated people at the end stage of their life due to AIDS with dignity, love, and caring and respect, and compassion. And that was so incredibly important for people. Oh, there we go. I think I'm going to be able to share my screen now. Just do the slideshow from the beginning. Okay, so hopefully you can all see that. This on the screen is the new building of Casey House that opened in 2017 at Jarvis and Isabella. This is what the old mansion looked like, which was just across the street. And here's some more images that you can see. When they built this building, talking about mental health, they really took care to have lots of natural light. So all of the patient rooms have natural light. The meeting rooms have natural light. There's a rooftop garden. There's an interior courtyard. When we were able to come together, we had Indigenous drumming there, and a number of other workshops. And it's just part of what Casey House does to help support the mental health and human connection that's so vital to our clients. We support clients in their individual journeys of health and wellness, and we do this in a variety of ways. We're currently serving over 800 people in our outpatient or day health program. We really try to walk our talk, and we created safety in many ways. So our washrooms are all gender neutral and for everyone, which I really love. We have an amazing harm reduction program, and have actually opened up our services to people at risk for HIV, as well as people living with HIV. We have the only safe inhalation room in Ontario, and one of only a few in the entire country, as well as safe injection sites. A little quirk with Ontario law is in the safe inhalation site, people can smoke crack and meth and any other drug, but not tobacco and cannabis. They're not allowed to do that because of some quirk in the law. So we have a subacute inpatient program for adults requiring 24/7 care. Admissions is based on medical priority. We have 14 beds. And also what's available is respite care. So if somebody is living in community and has a family member or a friend taking care of them, the person with HIV can come and stay with us for about 2 weeks, giving the care a chance to relax and rest and recharge their batteries and take care of themselves as well. So, you know, it's really, mental health is really important to Casey House. And that's one of the things I love about working there, that it's both emotional and physical health that we look at. For outpatient services, just there's tons of different programming that we do that's available, generally speaking, 9 to 5, Monday to Friday. We really work on mental health, physical health, emotional health, well-being, social interaction. There's a number of groups that are really just about social interaction, because as I'm sure many of you know, this can be a very isolating disease, HIV, and then to add to that, mental health issues. So having good socialization is really important, and that was a real challenge during COVID. We have many programs to support connection, reduce social isolation, increase and support positive mental wellness with clients. Casey House fosters an environment of the importance of a holistic approach to healthcare. So there's two programs that I wanted to speak about. One is the mental health series at Casey House that has our target audience is really anyone that works or interacts with people living with HIV. So it's ASOs, mental health programs, harm reduction programs, shelters, housing, public health, and we offer this 4 times a year. The sessions are about an hour and a half. They're free, which is really great. And there's a variety of topics. In November, we talked about isolation, mostly focused on COVID, but also other pandemics in the early days of HIV, and the social isolation that was imposed on us living with HIV due to stigma. Grief and ongoing multiple loss. We actually have a workshop on that coming up on Monday. And harm reduction, we put together a harm reduction series as well of 4 videos. It's on our website. Currently, our mental health series is online, which is really cool, because it used to be, it was our catchment area was really anyone that could get to downtown Toronto, and now with it being online, we're able to reach anyone in Ontario. It is our catchment area, and so grateful for that. The other program I wanted to talk about, and this one a little bit more, that Melissa mentioned in the introduction, is the Mental Health Network, which began in the 90s as a way to deal with ongoing multiple loss and trauma of the staff. For those of you like me that were around in those times, it was a difficult time. You never knew what was happening. Agencies and programs were just getting started. There were no rules. We came from a very different philosophy than a traditional social work, in that we it was really by people for people with HIV. There was lots of peer-to-peer support and networking that happened at the time, and it was really us just trying to take care of ourselves in the best way we could, because there were no formal programs. Agencies were on a shoestring budget and didn't have money, so it was really a peer-based model. Membership included ASOs and hospitals with HIV clinics at the time, and back when we were doing it in person, different agencies would host. So it also gave us an opportunity to see the space of various agencies in downtown Toronto, and offered those agencies a chance to show off what they were doing, and have a lot of pride in what they were doing. And that's something we didn't get a lot of chance to do, because the work just kept coming at us. And so that opportunity to really show off, and it's like, here are the cool things we're doing, and building those networks and building those relationships for support, but also for work and referrals of clients. It was a really close-knit, tight community. During COVID, we've shifted to online. So it's online only, and we've made a move to do more education versus the peer-to-peer support and network. It was just harder to do. So now our meetings, we do about a 45-minute educational piece, and then about a 30 to 45-minute networking piece where people can update on their services. But it's nothing like it was, and we're really hoping in the near future to be returning to in-person work. There's a number of agencies that that are form the steering committee, and Casey House is one of them, as is Melissa from Realize. And it's so we organize things with input from the whole network. It's a really cool model. So some of the challenges that we've experienced is caregivers and service providers are not, generally speaking, great at taking care of themselves. In fact, the way we frame presentations, and this has been in a lot of the work I've done when I was at ABRPO, as well as now doing the mental health series and with the mental health network. We can't say things like, come to a workshop and learn how to deal with your grief, because no one will come. But as soon as we say, come to a workshop and learn how to support your clients with their ongoing multiple loss and grief, all of a sudden we get tons of people signing up for it. Because it's so hard, and oftentimes, and it's so sad for me to think about this, but people aren't supported to take care of themselves during their work time. And that's really something a lot of us has had to fight for over the years, to access mental health supports, to have ongoing education and development of skills, to help us maintain our resiliency. And I loved Annalisa Babelo. I'm sure I got that wrong. I'm sorry, Annalisa, if you're here today, talking about personal days versus sick days. I used to work in an organization that didn't recognize mental health days at all. And if you were calling in sick, you had to be physically sick. And at the time, I was battling with severe depression. And luckily, I had a boss who understood. The rules were still the rules. You had to call in sick with a physical ailment. But my boss understood. So I would call in and say, I have a loose eyelash today that may detach at any moment, and I need to take the day to rest. In a tongue-in-cheek way of saying, I need a mental health day. I just can't call it a mental health day. So I would make up silly things like, I have a loose eyelash, and that's what I'm going to do. So what does mental health support look like where you work? Things to think about, and I could do a whole workshop on this, but don't have the time. I'm sure I'm already out of time. But how much agency or autonomy do you have over your own work? We heard a little bit about this with some of the speakers yesterday, and the importance of that, having some agency in your life. Support with ongoing multiple loss and grief. We all experience multiple loss and grief in our work. This stuff happens in our work. So really, in my opinion, we should be able to deal with it during work time and get work support to do it. Time off or flexible schedules to accommodate mental health appointments, policies and procedures to support a healthy work environment are all things to consider, and we need to challenge. And one thing I will say is sometimes I've been blessed to work in really supportive agencies and sometimes not. But at the end of the day, I take it upon myself because it's my health that I'm talking about. So I develop health relationships with my colleagues and others to do debriefing or whatever the things are that I need. And I take that time and develop those. Just to end off, when I was at ABRPO during the pandemic, we developed an online check-in for the staff, and we had some piecemeal consultants. And every week, it had nothing to do with work. It wasn't about your work plan or where you are in your budgets or any of that. It was us connecting as human beings. There was no hierarchy in that. It was just human beings talking to one another and supporting each other, listening and hearing each other. So I wish you all a wonderful rest of the conference and positive mental health in whatever way that works for you. And with that, I will end. Thank you.
Thank you so much, Thomas. It's always excellent to hear from you, and yes, some of your suggestions are wonderful. Yeah, I do remember Thomas saying at work at some point that he had to go home because his HIV hurt right here, and I thought that was just great, because yeah, it was a challenging environment to grapple with mental health challenges. So I am going to pass things along to Allison Cano now, who comes to us from the Bounce Back program. And because this is my first introduction to it as well, I'm going to stop there and just welcome Allison, and thank you so much for joining us today. Over to you.
Thank you so much, Melissa, and it's so wonderful to be here. I'm so grateful for this invitation. To start off with, I would like to gratefully acknowledge that I am a settler living on the traditional and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh peoples. So thank you so much for the invitation. I'm going to share a brief presentation about the Bounce Back program and about what we do in our program, and a little bit about what the what the program is designed to do for people. Let me just get this started. There we are. Thank you. So at Bounce Back, we are a program that is designed to be a self-help and guided support program for people struggling with mental health challenges and anybody really who wishes to improve on their mental health and hope that they can get a little bit of support with that. So it's a free evidence-based program with no wait list. We have a turnaround time for our coaching program, which I will get into a little bit more in detail in later slides. But our turnaround time is about 5 to 10 days from referral. So it really fills a real gap in our system of care for people who want to have tools and supports for their mental health, but really are not able to get in to see other issues or other areas. It's based in cognitive behavioral therapy, which is a treatment method that is often used in treating depression and anxiety symptoms. And that's really where the program is aimed at. It's aimed at people experiencing things like low mood, mild to moderate depression and anxiety, stress, worry, or even any of those many different symptoms of how depression and anxiety show up for people. And oftentimes it doesn't look like kind of the typical depression, anxiety symptoms that we think of. It might be unexplained GI issues or frequent headaches. It might be, feeling jumpy or kind of having a frequent startle response. So these are things that may often not be connected in people's minds with mental health challenges. And so what we want to really underscore in our program is there is no need for a diagnosis. You don't need to have a formal diagnosis of any mental health challenge to get help and to get support and to start working and hopefully improving your mental wellness. Our program has been funded by the Provincial Health Services Authority, and we've recently, in the last year and a bit, opened it up to British Columbians aged 13 and up. So we're hoping to be able to make this accessible to a wide range of people. As I said, our program is available for anyone with mental health challenges, with or without a formal diagnosis. And a lot of these symptoms, a lot of the things that show up for people when they're experiencing challenges with their mental health may not look like what you see the kind of typical or what you think of when you think of anxiety and depression. And what we hope to do with Bounce Back is to help people not only identify what it is that's going on for them that's kind of impacting their quality of life, but identify how that's working for them, how that shows up in their life, and have some tools and tips to help cope with that. And as I said, the program is based in cognitive behavioral therapy, which is really about the connection between the way we think, which is the cognitive side, and the way we act, which is the behavioral side. It's based on a program that was developed by Dr. Chris Williams, who's a psychiatrist in Scotland and a professor of psychiatry at the University of Glasgow. Now, he developed an approach called the 5 areas approach of cognitive behavioral therapy. And it's really understanding about how our life situations, that could be relationships, issues at work, things coming up for us in families, or living with a disability, any of those life situations that people are dealing with or that people experience, and how those impact our own internal way of working, that be our thinking, our feelings, behavior, physical symptoms. And the important thing with this is it's not to say that this is a way that, oh, well, if you just have positive thoughts and change your thinking, you can, fix or, stop being bothered by problems, especially kind of larger systemic issues, living in an ableist society, living in a society where people deal with the impacts of colonization, of racism, of all of these huge systemic issues. The goal of this kind of approach and of CBT is more to understand what is happening for ourselves while dealing with these larger issues, how that shows up for us, and how we can help cope with that, how we can help ourselves kind of interrupt those cycles of ruminating or, really kind of maladaptive or unhelpful coping strategies for that, and turn that and channel that into a different way of operating and a different way of thinking. The other thing about this is that the program really helps people to understand how any of these areas, be it your physical symptoms, your thinking, your behavior, your emotions, all kind of trickle down and cascade and work together. So if you change one area, or if you alter your habits or anything to do in one area, it can really have positive effects on the other things. So just to give a little bit of my own experience in using CBT, my personal experience has been in connecting with my body and understanding how things have impacted me physically, what things are showing up in my body, understanding why certain physical symptoms are showing up and how that's connected to my emotions, my feelings, and my mental health in general. And by connecting to that, understanding that, recognizing that, and then doing things that kind of change or help that, I can see the way that it goes on. So a lot of times with CBT, people start with the thinking, oh, I just have to alter my way of thinking or alter, how I think about this thing. And that's not always the case for some people. Other people choose to start in different ways. So I hope that gives a little bit of a better understanding. I also want to point out, I did see a comment in the chat that CBT is not the right tool for everyone. I absolutely agree, and we'll get into that a little bit. But what I like to say is that CBT is a tool. It is a tool in one's toolbox that you can use alongside other therapies. other treatment modalities, and other supports. So for a lot of people, CBT is not going to be the right support. They're not going to connect with it, and they're not going to maybe see the results that they need. And that's absolutely okay. I don't want it to come across as CBT being this kind of panacea for everything and for all. But it is a support for somebody in their toolbox. And that's kind of how I view it, is it may not be the right support for everyone. And it's certainly in most cases not the only thing that people can rely on. But it can be a helpful tool in your toolbox, essentially. So thank you for someone who brought that up. That's a really great point. We do have an evidence base for the bounce back. As I mentioned, CBT is a very widely accepted and widely used treatment modality for depression and anxiety. And in our own program, we collect a lot of evidence from our participants that allow us to track how well it's working and what it's doing for people. So one of the things is we look at assessment scores from a number of tools that we use for depression and anxiety severity symptoms. And what we've seen from over 15,000 people who have completed the Bounce Back program is that they report on average a 48% reduction in depression severity and 50% reduction in the severity of their anxiety symptoms. So that's looking at average scores for the severity of depression and the severity of anxiety symptoms when people start the program at intake, and again, repeating those scales for when they finish. On the other hand, we also see that for the whole cohort, for all of those 15,000 people who have completed the program, at the start of the program, 63% of those were in the moderate to severe category for depression symptoms. At the end of the program, only 19% of those 15,000 people were in the moderate to severe category. The rest were in minimal to mild symptom ranges. And we see a similar trend with anxiety. At the start of the program, 15,000 of those 15,000 people, 55%, the majority, were in that moderate to severe range of symptom severity. And at the end, only 15% were in moderate to severe. So the other 85% were in that minimal to mild category range. We also collect a number of testimonials from people who have completed the Bounce Back program. And really, a lot of it, what we hear is that, again, for a lot of people, it's not going to be kind of the be all end all, I did this program and now my mental health is fixed. But for a lot of people, they do come away with some practical tools and they feel like they have just a few more skills in their toolbox, basically. This is something that we hear a lot from people, is that they have kind of an increased capacity and a little bit of a different, just different way of thinking of things, and a few additional tools that they can use when things start to come up from them. The other thing that we try to promote with our program, and our coaches do this as well, is trying to promote a real strength-based approach. So allowing people to see that it's not, a failing or something that they need to fix, but really understanding what they can do and what their resilience and what their strengths already are to help kind of just practice and kind of uncover and develop some more tools. So we try to take that approach with that, and we do hear that a little bit with our participants in their in their feedback and their testimonials. So I just noticed a question, and if there's differences in mental health outcomes, e.g. symptom severity, for people who do Bounce Back self-paced versus with a coach. So we don't actually have a lot of data for the self-paced kind of online program that we have, because we don't collect those data for pre and post as much as we're able to do with the coaching. So I actually can't enable or answer that question very clearly now. However, we do have studies, other studies, not necessarily for the Bounce Back program, but there have been other studies about online, self-help, kind of completely self-directed CBT programming that do show increases and I guess or increases in mental health symptoms, or I should say decreases in mental health symptoms such as anxiety and depression. I don't have those stats off the top of my head, but I know there have been similar studies to programs similar to the online self-paced delivery method of Bounce Back. So that brings me to the different delivery methods of our program. The main one that we talk about a lot is the coaching program. This is what we kind of consider our bread and butter of the program. And it's still kind of a self-directed, skills-based learning course, but you also have the support of a coach who goes along with the program with you and helps you to work through the lessons and the workbooks in the program. The second option is the Bounce Back online program, which is a completely independent online learning program, self-paced, self-directed. You go through the workbooks in a online platform through e-reader books and work through at your own pace. We finally also have the Bounce Back Today video series, which is a series of videos that delivers practical tips, kind of walks through that CBT model that I explained earlier, and also gives a bit of an introduction of what the Bounce Back program is. So it's a little easier to kind of see what you're getting into. As I said, the Bounce Back coaching is really designed to walk you through the program. Our coach's job is really to provide support and encouragement, help clarify the lessons in the workbooks, and help you apply what you're learning to your own life and really keep you motivated. And that's the main thing that people take away from the course, is that their coach helps them keep motivated and keeps going on through the course. The coaching program is 4 to 6 sessions with the same coach. You're working with the same one throughout. And really they help review workbook lessons, discuss problem areas you may be stuck on, talk about how to apply the workbooks in your own life. And you also have the option to have booster sessions after you finish the program if you need a little bit of extra support or something comes up, even up to 6 months after you've completed the sessions. Our workbooks are designed to really help people with a huge range of things in their lives. So it might be overcoming sleep problems, building relationships with family and friends. And this is a real self-directed course. So you can choose what's going to be most relevant for you after kind of completing those core essential workbooks around anxiety and depression symptoms. Bounce Back coaching does need a referral from a physician, but this can be a doctor, a family physician, or from a walk-in clinic or telehealth clinic. It can be a nurse practitioner, psychiatrist, or for youth, a school counselor or a Foundry virtual counselor. We also have those options of the completely self-directed online program or Bounce Back Today videos if you're not connected to a primary care provider. And none of our sessions are paid. Every session, even the booster sessions, are completely free of cost. Program eligibility, as I said, it's not for everyone. It's really aimed for those with mild to moderate symptom ranges. So our eligibility criteria are designed to ensure that Bounce Back is the right support program for somebody and is the right level of support. We hope that people are not undertreated by the program. So for those not meeting the eligibility criteria, the reason that we have this is to really ensure that people are getting the right level of support and aren't getting funneled into the Bounce Back program when they really need other areas or other treatment modalities to help them. So as I said, Bounce Back Online is available for anyone at any time without a referral, and the same thing with the video series. Bounce Back Coaching is available in English, French, Punjabi, Cantonese, and Mandarin. And the video series is available in English, French, Punjabi, Cantonese, Mandarin, Farsi, and Arabic. So that brings me to the end of my presentation about Bounce Back. I always leave it with this slide, just with a few additional resources for anyone needing additional support. So I hope this kind of clarified a little bit about one of the support options out there for people. And yes, I can definitely share the Bounce Back Online link into the chat.
Thank you so much. Thank you both to Thomas and to Allison for being with us today. Allison did a wonderful job of answering questions throughout, so thank you very much for that. It it gave us the opportunity to stay on time. So just extending again, great thanks to both of you for being here with us today. As I did with the previous speakers, I encourage you to stay on for a few more minutes to see if there's anything that you want to address in the chat, perhaps to share your email addresses should anybody want to reach out to you. Allison, we've shared the Bounce Back link a couple of times in the chat. It does appear to be nationwide. When you go to that bounceback.cmha.ca page, there's a drop-down menu for you to select your province or territory. So I believe that there are programs accessible across the country. So hopefully people can find what they're looking for there. For now, I'm going to do what we were encouraged to do yesterday by one of our speakers, Guy Baudet, who said that we need to take opportunities to reset. And because our interpreters are working incredibly hard, many of them are translating that from English to French and then to LSQ. We've got a lot going on here. So let's take 15 minutes and reset. We will be back at 2 o'clock Eastern time with additional speakers as well as our keynote and a closing from our dear Elder Valerie. I hope that you can all join us then. Stay on the Zoom. Just turn off your camera and we will see you again at 2 o'clock. Thank you so much for being here with us.